Hello Malaysia and welcome to the final edition of Medical Day in Season 2. I'm Jared Ratnam. This is episode 13. A lot is happening on the show. But as always, we begin the show with aging and well-being. And I have my wingman here. He's been here all season, Dr. Navindra Nageswaran, the Group Managing Director of Global Doctors. And he's joined by Dr. Lale Merlet, a consultant psychologist and psychotherapist from Global Doctors. Thank you very much, doctors, for coming in. It's a pleasure to have the both of you here. Dr. Lale, our first time having you on the show, and we are very honored to have you here.
Thank you very much. It's
a lot
my
to talk
pleasure.
About. Yeah, a lot to talk about with regards to psychologist's perspective, with regards to aged care in Europe, how to manage and live with it in Europe. So, Dr. Navin, how are we going to start this off? No, let's talk about which country in Europe has the best elderly care. Maybe you can walk us through that.
Yeah, countries like Sweden, okay, basically the Scandinavian countries. They've got a very good system in place. They've put a lot of structures, social welfare and well-being. At the same time, homes. But Sweden is number one. Then we have Norway. Then we come down to Italy, Spain, France, Netherlands, and majority of them are in the Europe.
You look at that list, and of course, it says that the Scandinavians have thought about it a lot.
Yeah.
Is there anything in their ethos and philosophy that talks about the aged and people who are growing older, which makes them think about that first, or then put that on a priority list?
They reached the aging population a bit more 2 decades before we are. Like we did mention in the show many times that Malaysia is going to be reaching it in 2030, 20%. But whereas countries like France already has about
already near 20, like 19% of people
2
are
decades ago.
65 year or above. So already.
So Dr. Lale, I mean, the term manage, I find it hard to use the term managing people, but no, when it comes to the elderly, there is a sort of management that needs to come around taking care of them or their well-being. Now, how do they manage the elderly within Europe at this point?
Actually, the problem with elderly, especially when they have a dementia, is with cognitive impairment. Cognition is the first factor which decides if a person can live independently in an autonomous way. When there's a decline in cognition, the person needs help. And in a dementia case, in further stages of dementia, we need to have a person all the time who will take care of the elderly. Because of forgetfulness, because of many problems, the person becomes dependent. In France, actually, we have nursing homes, especially designed for people suffering from dementia. However, it is not all rose either in France. We have to improve because we lack some human resources. We need more
manpower
staff. Definitely.
So if we're talking about France, let's dial back to where we are. What's it like here?
Here, I mean, it's slowly developing. We've got about nearly, I mean, our whole mental health is what was mentioned the last.
I saw you with a loaded gun then. Somehow,
5%. But now I think in Malaysia we're slowly getting there, and I think majority of the thing is dementia. One of the causative factors are not active at work, not basically learned enough, and not keeping active. Basically, activity is one of the biggest component inside for dementia.
Right. So we say that activity, being sedentary is no good. Activity is good, especially brain activity, exercise, so on and so forth. Yeah. But at what age do you start all this? And are all of us aware of this?
This is very important actually to have the awareness about cognitive health. It is not to start at any age all the time. We have to start, from childhood until death. Cognitive health is very important. But of course, especially from 65-year-old and above, it may become a real issue.
Let me throw you a bonus question here. Okay, you talk about cognitive health and you talk about staying healthy and making sure you're giving your brain exercise. You want to build better neural pathways, so to speak.
Yes,
definitely.
Having said that, as a psychologist and a psychotherapist, do you do that on your own?
Oh, actually, yes.
Yes? Oh,
Yes, of course.
I was hoping for no, so I could further
Actually,
interrogate.
my specialty is about memory processes.
IQ testing.
IQ testing.
You can try the test out.
Okay,
Yes.
let's make a test
Thanks for getting me
you.
into trouble. Thank you very much. Yeah.
No, not the IQ test, but if you agree, I will.
I can bring my friend Sam in. He's
Okay.
the studio director. No, would you like me to bring? Okay.
As
So
you
I'll do
wish.
the test. I'll do the test.
Okay, okay, let's do it.
Okay.
So it will be just a short
No one's going to make a
screening.
fool of me here. Right?
You
Right.
know,
Okay.
it will be a short screening test for dementia. Okay,
Let's go.
It's actually
Let's go.
designed for elderly people. You will do it perfectly.
Then you should be doing it on Dr. Navin.
The thing is, he's
Okay,
too
let's
smart
try.
for this.
Okay. Yeah.
Okay, please listen to me carefully. I will give you
Okay.
4 words, and I
Four
would
words,
like
okay.
you, and I would like you to repeat them back to me,
Okay.
and just try to remember them.
Right.
Are you ready?
I am ready.
Lemon,
Lemon,
shoes,
shoes,
horse,
horse,
couch.
couch. Lemon, shoes, horse,
Okay.
couch. Okay.
Now, let's do something else. Okay?
This is embarrassing. Okay. Yeah.
Okay, please count from 115. Count back from 115 by
I'll
7.
7. Okay. I'll have you know that I haven't done math in school and I didn't do well. So let's try. 115 by 7. So I'm going to subtract 7 from
Yes.
115. 115 minus 7 is 148.
115.
And,
1-5.
well, 115. Sorry. 115 minus 7 is 108. Yeah. Okay.
101.
Okay, continue please.
Okay. 108 minus 7 is 101. 101 minus
94.
7 is
94.
94. Yeah, okay.
Great.
Okay.
Then
94 minus 7 is
7,
87. Okay.
80.
Okay, and it goes on and on.
80,
80. Okay, 80.
73.
74.
73,
73. Right. 73 minus 7. 64.
66,
Okay. 66. Okay.
59.
59. And
52,
52.
45.
Sam, I'm looking for some help here.
45,
45. Okay.
Yeah, then 38.
38. 38 minus 7 is 31.
31.
31 minus 7 is
23.
34. 30,
Yes,
34.
yes.
34 minus 7.
24,
24. Yeah. 24 minus 7 is
17.
17. 17 minus 7
10.
is 10. 10
And
minus 7
7.
is 3.
Okay,
Yeah.
great.
Jeez.
Nice.
Thanks a lot, guys.
Okay, you
I'm
passed
thanking the guys
test.
behind the
Actually,
scenes. Yeah,
it's
yeah.
a good thing. Sometimes we don't tend to do this. We have got different kinds of memories. We got recent memory. We remember that.
Right.
There are some things people amazingly, we've been talking about well-being in the aged group. They remember the past. They remember their events. They remember dates. Can you imagine? They remember everything. But when it
Right.
comes to certain numbers, phone numbers, names of people, and now with the new technology, we can't even remember phone
yeah,
numbers
because
Right.
because
we
everything
don't
is
remember
pressed on button.
numbers, we don't remember roots.
Exactly. And thanks to calculators, everything, even 5 digits you need to add, 1 plus 2, you need a calculator
Right.
already.
Okay,
Right.
so I've been embarrassed on national TV with bad math. Now, can you tell me why we did that test?
Actually, what I ask you lastly to count back from 115 by 7.
Indians
is-
can't count.
It is just an interfering task that we give after the memory test.
Right.
But we will continue. Let's talk about other things and then we can continue.
We can continue.
Yes,
Okay.
our
So this is
memory
This is part
assessment.
1 of the test. So we're going to continue with the interview now. With all the people that you see, I'm sure you see them first. Okay,
Yes.
at Global Doctors, people come in, they see you first. What are the telltale signs that they need to be referred to her?
Usually one of the biggest problem, as what we've been mentioning in the show, is depression. Depression, loneliness, and these things don't give them motivation. They come down already. They can't sleep in the nights. They have loss of appetite. They don't feel like eating. They've lost of weight, inactivity to do things. Nothing motivates them. If you know, I think yesterday, okay, what would it take a 93-year-old man to jump on a sports car and take it on a sprint and the F1 track? That's our Prime Minister who just did it. So if everybody gets motivated like that, we don't need to take a race car, but at least you take your car and drive it around the car park. That it's, or start it and switch it off. At least that activity will give you all the strength training and all the things that we need to do.
Actually, these are all protection factors. Cognitive training, using your mind, doing calculation, mathematics, just without using pen and pencil, like just we did before. All these help you to keep a sharp mind.
Right. Hold that thought. We're going to take a short break, and when we come back, we're going to find out more about health, especially a psychologist's perspective with regards to aged care in Europe, and also how to manage and live with them. Right here on Medical Today BNC. We'll be right back shortly. Stay with us.
I have a vision correction number, but I'm more than a number. When I'm not enjoying my little sunshine, I'm enjoying my city's modern architecture. My Essilor lenses go beyond my correction. Their Creasel technology shields my eyes from reflections, scratches and smudges for optimal clarity. I'm more than a number. I'm a crystal clear catcher of the perfect image.
See more, do more. Essilor. Ask your eye care expert for advice.
I have a vision correction number, but I'm more than a number. When I'm not sharing ideas with my colleagues, I'm defending my kingdom on the back of a dragon. My Eyezen lenses go beyond my correction. They keep my eyes relaxed to stay focused and protect me from harmful blue light. I'm more than a number. I'm the never tired Dragon Eye. Eyezen.
Ask your eye care professional. See more, do more. Essilor.
Thank you for staying with us right here on Medical Today, the final episode. And with me in the studio is Dr. Navindra Nageswaran and Dr. Lale Merlet. I hope I got the pronunciation right.
Thank you.
Well, we're talking about a psychologist's perspective with regards to aged care in Europe and managing and living with a person who's aged or who has problems or cognitive problems. Yeah, right. Now, having said that, let's take a look at risk factors and protection factors, as you said. What do we need to be cognizant of?
Okay, actually, the primary risk factor is aging. But the age is not the reason, is not the cause, it's just the risk factor, which is the most important among other factors.
But they're saying when you age, you kind of forget things, you know, it's a slow process, but there is deterioration. Do you believe in that?
I don't.
Do you subscribe to that? No.
No. Simply because, you see, as we grow older, there is something of vocabulary. Your ability to understand crystallizes more. Your general knowledge increases. Your whole vocabulary, what you had 10 years, decades and decades, as you keep growing older, it only gets better. So technically, you should be better when you're older. But you have this risk factor inside. It's keeping the whole... It's like a computer. The older the computer gets, the more memory bank, the more you enter inside. It's artificial intelligence. This is biological intelligence.
Would you like to add to that?
Actually, I do agree with crystallized intelligence, which becomes better as we get older. However, we have what we call fluid intelligence, which is related your memory, episodic memories, semantic memory, and processing speed, psychomotor abilities, executive functioning. All these show some decline while we age. So let's talk about memory, because memory complaint is the primary complaint amongst elderly.
Right. But diagnosis is usually clinical, isn't it?
Yes.
I mean, there's no blood test to ascertain this or to...
It is mainly clinical.
Assessment.
Definitely. So we have whole neuropsychological batteries to detect and diagnose dementia.
Right.
Alzheimer's disease is one of the dementias which is most frequent. In France, 70% of dementia cases are Alzheimer's disease. But there are also other types of dementias, of course. Our neuropsychological assessment can help to distinguish also between these different types of dementia.
Let's go back to France, because you know a lot about France. Let's talk about the aging population there.
Yes.
Yeah. Well, what else can you tell us about the aging population there?
Actually, our population is about 67 million now. And as I said before, it's about 18 to 19% of this population is 65-year-old or above. And what we expect, not only in France, but in all over Europe, what we expect that in 2050, 1/3 of our population will become elderly, which means 65 or above. And now today in France, we have 3 million people suffering from Alzheimer's disease. And all dementia cases together, it makes like 4 million people suffering from dementia just today. And when we look at the figures, you know, every day there are new cases of dementia. 660 new cases per day for only Alzheimer's disease, only in France, which makes like 225,000 people new Alzheimer's disease cases each year.
Right, but are studies being done to find out why it's happening at such a rapid pace?
Oh, okay. Actually, we were just talking about the risk factors. So, of course, there are different risk factors. There are also some genetic factors. But one of the risk factors, so, is aging. As we get age, we have more chance to get dementia. At the age of 65, our risk is about 2%.
Right.
And it doubles every 5 years, which means when you are 70, it becomes 4%, and then 8%, and so on. And after the age of 90-year-old, it's more than 50%.
Let's get Dr. Navin's perspective on this. I'm sure you've done a bit of reading up as to what happens in Europe too. What are your thoughts about France and what she's saying about France?
It's very true, and I think in Europe itself, I think about by 2050, you're looking at about 50 million people having it. Southeast Asia, it's already increasing rapidly, and countries like Malaysia will be about 20% of the age population by 2030. We're just a couple of years ahead of us.
But everyone looks at it, you know, I mean, I'm sure there's no one silver bullet for this, but in every country it's different. And for us, the closest model would be Australia.
Yes.
Are we taking steps to emulate what Australia has done? Apparently they have a good system.
I would
there.
say there's slight difference. See, in Europe, there's a lot of independent living, and the chances of here it's very family oriented, as we were discussing several times. Families don't let go of their parents into a home very rarely, and if they do that too, it's also because of other underlying conditions like dementia, Alzheimer's, where they cannot manage it at home. And many a times, many of the people are not living alone. Women live longer. So in Europe, you'll see in France,
lucky you.
Yeah, women
Dr.
actually
Lale.
live alone longer than the men, because the men's either gone or not around. So these are the reasons.
Life expectancy is 85 years old for women, and it's about 78, I think, for men.
Right. Now, there's a question here that talks about, you know, how to live with an elderly at home. Now, for us Asians, it's even hard for us to start thinking about it. Well, how can I even say that? But yeah, but this is a question that's being brought up in order to make people be able to approach these things with better methods.
Yeah.
Right. So, what are your thoughts about living and managing an elderly at home?
Yes. The thing is that first thing, the elderly will need checkups, not only for their physical health, but their cognition, their cognitive health. So regular checkups are very important to detect early signs and symptoms of dementia cases. This is the first thing. And if the person is suffering from, let's say, mild cognitive impairment or declared dementia, so the family has to be aware that there will be some challenges.
Early checkup is good and all that. You go to a primary healthcare physician and say, I think, you know, my father's not remembering things. Uncle, open your eyes. Let me see this way, that way.
That's why you have to go and see a psychologist.
Right. So that's the problem.
That's why you need to refer to a psychologist and do that. And at the same time, it's like the test we just did just now at the beginning.
So, what were the words that I gave you?
Okay,
please?
hang on. A horse, I know, my favorite animal. My favorite fruit is a lemon.
Yeah.
I know I like wearing my shoes. I like sneakers. And I am a couch potato.
Okay,
brilliant.
great.
You see, I want to take
up. Amazing or what?
You're amazing. No, but what is important is what he just said. You need to relate it rather than memorizing it as lemon, couch, you know. You related it to himself.
You created mental images.
Mental images, you created it, and that whole thing is what's on a daily basis.
Right. Yes.
If everybody does that, of what you just did with your favorite fruit is a lemon.
And
instead of memorizing it,
categories.
you correlate it to your life.
Right. Having said that, we've got a couple of minutes left. I think a little bit less than 2 minutes. What would be your parting advice to us or your tip for us with regards to mental health?
Okay, for protection factors, so the first of all these protection factors is higher level education. But of course, if our education level was not high, let's say we didn't have the chance to go to the university, there is no age to learn new things.
Right.
So learning is really the most important thing.
Read the newspaper every day.
Definitely. So we can try to learn a new
something
language.
we don't do anymore, right?
We can learn a foreign language, we can learn how to play a musical instrument, we can attend some classes, and socializing is very important. When the people are isolated and they feel lonely, there are more risk to have a dementia.
If you have a Filipino caretaker, start learning Philippines. You know, if you have an Indonesian caretaker,
you need to challenge yourself.
Challenge yourself.
Definitely.
We're running out of time. I'd like to thank you very much, Dr. Lale. It was
very much.
Pleasure having you on air. Dr. Navin, as always, was great being with you on season 2 of Medical Today. I hope we can meet each other once again in season 3. Well, we just talked about a psychologist's perspective with regards to managing and living with the elderly. I would like to thank our doctors for coming in, Dr. Navindra Nageswaran and Dr. Lale, a psychologist and also a psychotherapist, for taking time off a busy schedule to join us right here on Medical Day. We're going to come back with more. We're going to walk into the emergency room after this. Stay with us. We'll be back with that shortly, right here on the final episode of Medical Today.
I have a vision correction number, but I'm more than a number. When I'm not teaching courses, I'm taking steeper grades and tight corners. My SLR lenses go beyond my correction. They make my vision as sharp as my reflexes to capture every detail from near to far at any speed. I'm more than a number. I'm a rapidly focusing champion of courses.
See more, do more. Essilor. Ask your eye care expert for advice.
I have a vision correction number, but I'm more than a number. When I'm not enjoying my little sunshine, I'm enjoying my city's modern architecture. My Essilor lenses go beyond my correction. Their Creasel technology shields my eyes from reflections, scratches and smudges for optimal clarity. I'm more than a number. I'm a crystal clear catcher of the perfect image.
See more, do more. Essilor. Ask your eye care expert for advice.
Hello, and thank you very much for staying with us right here on Medical Today. I certainly do hope you enjoyed the segment we had a while ago. We talked to a psychologist about a psychologist's perspective with regards to the aged care in Europe. From there, we move on to emergencies. Well, in an emergency setting, most of us don't plan to get there. We always end up there. But did you know that the healthcare professionals and the trained specialists within an emergency setting has to work with precision? They have to mete out precision at all times. And of course, to talk about that, we've got Dr. Chiun. He's a consultant emergency physician from Regency Specialist Hospital. Our on-site host, Nurata Amin, had a chat with that man. Let's take a look at what he had to say.
Tide, wait for no man. Time is of essence in saving one's life. How fast an emergency service department reacts, responds, and manages the situation is critical. It is, after all, the first line of defense for critical patients. Let us talk to Dr. Chiun to get more insights on accidents and emergencies. Dr. Chiun. Hi, I'm Nurata Amin from Bernama Medical Today.
Let's go to my office.
Okay, sure. How are you?
Fine.
Dr. Chai, what are the roles of an emergency specialist and the difference between an emergency specialist and a medical officer?
Three words to describe the roles of emergency physicians. First, to diagnose. Second, to stabilize.
Right.
Third, to coordinate.
Okay.
So, to diagnose, when a patient comes, we actually had, initially we had know nothing about the patients. So we had to identify and find out what is the problem with the patients. Second, if the patient is in critical condition or life in danger, then we had to stabilize the patients, deliver immediate treatment or immediate intervention to stabilize the patients.
All right.
The third part, coordinations. Sometimes a patient may have which needs multiple specialists.
Oh.
So emergency physician will be the one that coordinate the cooperation of the multiple disciplines.
Right. Okay.
Yeah, the difference between the emergency physician and MO is the trainings. An emergency MO can be, anyone can be emergency MO as long as he get a medical degree for any universities.
Okay.
For an emergency physician or emergency specialist, you need to have a specialist training in the local in the universities or abroad to acquire these qualifications. So the difference is, first, the knowledge. Second, the intervention that the emergency physician can do. And the third part is the experience, working experience. So about the intervention part, the emergency physician actually have a whole list of procedures which they are qualified to perform. Compared to medical officers, they are not that qualified. Okay. For example, okay, an orthopedic surgeon, they can do a orthopedic fracture management.
Okay.
But a gynecologist are not qualified to do it.
Yeah.
So, same as emergency physician, we are qualified to do the life-saving interventions. But some MO are not qualified to do it. When all these difference will translate into the better outcome of the patients. How we do that? First, we actually can deliver the life-saving intervention faster. Second, we can diagnose and identify the patient's problem faster.
All right, and less risk.
Yeah, with less risk.
That's quite a big difference. Yeah. Okay. Your emergency services have specialists compared to many other hospitals in Malaysia. So, doctor, could you elaborate?
In emergency specialist hospital, the emergency is held by emergency physicians. So all the patients arrive will be attended by emergency physicians. So compared to other hospitals, most of the hospital they have a medical officer which in charge of emergency. At the same time, may take care of the patients in the ward. So in our hospital, we are more focused to the patients compared to other hospitals.
All right. And this is what I'm kind of like interested in. What are the examples of successful cases with good outcome?
Okay. The two types of cases actually which can make a very obvious good outcome is, okay, first, myocardial infarction or what we say heart attack. Second, stroke. Okay. These two conditions actually, the prognosis is very dependent on the time of the treatment. For example, a heart attack patient, if you deliver treatment within 3 hours, the outcome is very good, and the patient may have a high chance to return to normal life.
Okay.
For the stroke, if you arrive in the emergency and receive thrombolysis treatment within 4.5 hours, you can actually recover. You can have a chance to fully recover and with no neurological deficit.
So, what are the most common cases in A&E?
The common cases actually is more to the communicable disease, okay, such as the dengue, influenza, respiratory tract infections, urinary tract infections, and GI tract infection, gastrointestinal. Okay, but for the higher age group of patients, such as middle age, non-communicable disease is becoming more common. Right. This disease example are ischemic heart disease, then stroke, diabetic or hypertensive related disease. Accident is another portion of the illness, but it's not as big as the
stroke and
the
rest that you mentioned.
Yeah.
All right. What are the more complicated cases being handled by Regency Specialist Hospital? Maybe you can give examples, and how do you handle it?
One of the examples actually is a sepsis with multi-organ failure. Sepsis is a condition where you the patients have a source of infection in the body. Whether it can be from the lung, urinary tract, or stomach, or even an abscess or pus in any part of the body. And then when the organism that infected the patients actually produce toxin and spread to the body, it will actually trigger a series of immune response, which may lead to the multiple complications.
Okay, such as?
Such as, okay, for example, okay, it actually can lead to the low blood pressure, what we call shock, which is the condition where the blood, the cell didn't get enough blood supply and oxygens. Second, it may lead to kidney failure. Third, it may actually cause injury to the lungs and cause water accumulation in the lung, which is what we call acute respiratory distress syndrome. So this condition is a very fatal, actually, because it involves multiple organs and actually need to be managed very carefully. The mortality rate of the multi-organ sepsis with multi-organ severe sepsis actually can be up to 20 to 30%. Okay, to manage this kind of condition, for my part, I need to actually identify this condition fast. A lot of time, the symptom can be very vague. For example, in old people, it can the main complaint may be just having a fever for a few days, then after that, generalized weakness.
Oh, okay.
Yeah, without any other obvious symptoms.
So these cases are complicated and critical at the same time.
Yeah.
So timing is really crucial.
Timing is crucial. We have to actually, the treatment of this condition actually is first, you identify it. Second, we have to actually stop the infective process of the organism. So you have to deliver the antibiotic or antiviral to kill off whatever microorganism that infected the patients. Then the third, to stabilize the patient, you have to support the whatever organs that are failing. If the patient have a lungs failing, then you may actually need to support the lung with an oxygen supply, or in the worst scenario, use the machine to take over the ventilations, such as you intubate the patients or use a positive pressure ventilations.
Right, okay.
Let's say the kidney is failed, then you may need to actually consider a dialysis. If the blood pressure or cardiovascular system failing, we have to aggressively bring out the blood pressure.
Right, okay.
So in this situation, need a coordination of multidisciplines. To support the lungs, you need an anesthesiologist.
So that's one of the specialists?
Yeah, one of the specialists.
Okay.
Which actually is well trained in the airway management, oxygenation and ventilation of the patients.
Airway management.
Yeah.
That sounds interesting,
Yeah.
right.
Then for the
Besides
support
that?
the kidney, monitor the output of the kidney, nephrologist is crucial. The role of nephrologist is actually to monitor the kidney and initiate dialysis when necessary. The dialysis can be done for a few purposes. One, actually to take out whatever uric acid that overflow in the body. Second, to reverse the pH, the acidity, to improve the acidity of the blood. And then the third can actually use to extract out extra fluid in the body. Then and sometimes in the sepsis patient, you may even need a surgeon or orthopedic surgeons to manage it. Let's say the patients have a source of infection which is inside the stomach, what we call peritonitis conditions. So you may need a surgeon to open out the stomach and wash out the stomach, the abdomen cavity. Let's say the patient, the source is actually a pus or abscess, have an abscess in the limbs, then you need an orthopedic surgeon, pus inside there.
Right.
Yeah,
Okay.
clean out.
So, Doctor, could you kindly share as well some of the accident cases and how the doctors deal with it?
Okay. 2 days ago, I have a case where a mechanic actually is repairing a tire in a tire shop. So he tried to inflate a balloon, then overinflate it. Then the balloon burst and hit his chest. So what happened is he started to develop massive swelling from the lower jaw to the upper chest. The swelling actually started to compress his airway and then obstructed his breathing. So these cases, when he arrived, he already in the very severe shortness of breath. And he was actually immediately actually stabilized by inserting an endotracheal tube to actually establish to open out the airway to help him breathe. Then later on, actually, we noticed that because of the impact, there is a air leakage below the rib cage of the lung. So air leakage at the rib cage, which is a condition what we call pneumothorax. And then subsequently, we had to put in a 2 chest tube. Basically, it's a tube that inserted into the pleural cavity of the lung to drain out the air, to decompress the lung. So by this, then we managed to stabilize the patients.
Okay. So may I know how his condition currently?
He was stabilized after the treatment.
Okay.
Yeah.
All right. Besides that, what if the cases involve more than one specialist in specific fields of expertise? So how do you coordinate this, doctor?
Okay. The typical case that involves more than one doctor is polytrauma, which is a condition where a patient have an injury that involves 2 or more organ systems. Okay. For example, let's say a person have fall from height, maybe 2 or 3 story, so he may injure his leg, abdomen, or have fracture of the spine, and have an injury of the head. So for the injury of the head, he need a neurosurgeon. For the spine injury, he may need an orthopedic surgeon. For the injury of the abdomen, he need a general surgeon. And for the leg injury, he also need a orthopedic surgeons.
Right.
So what happened is, emergency physician role is to identify this problem, stabilize the patients while activate all the necessary specialties to treat the patients.
Right. Is that common?
It's not common actually. Polytrauma is it's not common.
Okay. What if you have 2 or 3 critical cases at the same time?
Okay. In Regency Specialist Hospital, we established a code system. So it means that when the emergency is overwhelmed, we can actually activate the code system. With the activation of code, okay, all the other specialists will actually come to emergency and help out emergency. One of the situations I remember actually is a few months ago, I have a patient actually have a very severe lung infection, which I was very busily attending the patient, trying to stabilize the patients. At the same time, I have another patient brought in by ambulance where the patient have cardiac arrested at home.
Oh, okay.
So when I had no time to manage the patients because the other one also is not stable.
Yeah.
So what I do, I activate the code, and then all the several specialists actually come down. With the extra help, then we can actually manage to stabilize it.
Oh, right.
We manage to actually handle both 2 critical cases together.
Okay. What do you mean by activating the code? It sounds interesting.
There is a protocol in our hospital. So basically mean that we give a call to the operator, telephone operator, say whatever code you want to activate. For example, if someone is arrested, we activate code blue. So when the code blue, when I taught this to the operator will start announce using the PA system, the hospital. So we say code blue, what is the locations of the code?
Okay.
So for example, let's say I have a patient arrested in the ward 3A, then the operator will say code blue, patient arrested in ward 3A.
Okay.
So anybody who actually heard this message can go to the 3A to provide help to stabilize the patient.
Okay, come to our last question. Besides dealing with the patients, what about the emotional factors involving family members, right? Because I understand the family members, the patients are normally not in the emotional state, but the family members. So, doctor, how do you usually deal with these families?
It's not uncommon about the emotion part. The one of the most prominent conditions which we need to handle with the emotion aspect of the patient family is actually cardiac arrested case. I have seen patients with the families really coming, shouting, crying because of the relatives is arrested. So the key actually to manage this condition is communications. Okay, from the patient once step into the emergency, once I manage to actually do whatever necessary, I will immediately update the family what is the patient's conditions. For example, for an arrested patient, I will actually update them, say that, okay, your family condition is arrested, there is no breathing, no heart rate.
Okay.
Okay, so we are trying our best to try to revive the heart and breathe, and then to restart the breathing. And then subsequently, then during the process of CPR or resuscitation, we had to continuously update the patients. Maybe every 5 minutes or 10 minutes, inform them, okay, repeatedly. And then whatever changes, inform the family.
Right.
Then eventually, after the certain period of resuscitation, for example, after 30 minutes, if the outcome is actually bad, I mean that it's futile, then we had to actually repeatedly, update the family again. This is the condition. What we have done the best.
All right.
Yeah.
Doctor, I think you've been doing really a good job at Regency Specialist Hospital. Keep it up.
Oh, thanks.
Right. So thank you, Doctor, for being with us on Medical Today. I'm Akhtamin.
Certainly hope you enjoyed that. Nurata Amin speaking to Dr. Chiun, a consultant emergency physician from the Regency Specialist Hospital, talking about emergencies or an emergency department. A lot happens in an emergency department, but you don't forget, if you have an emergency, dial 999 first. We'll take a short break and come back with more for you right here on the final episode of Medical Today.
I have a vision correction number, but I'm more than a number. When I'm not sharing ideas with my colleagues, I'm defending my kingdom on the back of a dragon. My Eyezen lenses go beyond my correction. They keep my eyes relaxed to stay focused and protect me from harmful blue light. I'm more than a number. I'm the never-tired Dragon Eye, Eyezen.
Ask your eye care professional. See more, do more. Essilor.
I have a vision correction number, but I'm more than a number. When I'm not teaching courses, I'm taking steeper grades and tight corners. My SLR lenses go beyond my correction. They make my vision as sharp as my reflexes to capture every detail from near to far at any speed. I'm more than a number. I'm a rapidly focusing champion of courses.
See more, do more. Essilor. Ask your eye care expert for advice.
Welcome back to the final episode 13 of Medical Today with me, Jared Ratnam. This is our final segment. And in our final segment, we want to say our thank yous. Firstly, we'd like to thank all the great physicians and consultants from Makotha Medical Center in Malacca and also the Regency Specialist Hospital in Johor. They've taken time off their busy schedules to join us and to give us great insights on what they do. Having said that, we'd also like to thank our on-site host, our very lovely Nurata Amin, who's been out there interviewing all these great doctors and subject matter experts. On that note, I'd also like to thank Icon and Essilor for coming in to help us with eye health. Now, periodically we talked about eye health and we had friends from Icon and Essilor come in to help us out. We also want to thank the doctors for coming in to talk about aging and well-being. We had an aging and well-being series. Of course, Dr. Navin joined us to talk about that. And of course, you for staying with us on a weekly basis right here on Medical Today. Remember, we had accidents and incidents, and that video always talked about calling 999 or dialing 999 when you have an emergency, or if there's a situation that requires emergency, call 999 first. So having said all my goodbyes, once again, I'd like to thank you, and I would like to ask of you to send us an email. That's if you do have any question for us, or if you'd like for us to feature anyone in Season 3, which will be coming up very, very soon. Please do send us an email. Send it to ask@medicaltoday.my. That's ask@medicaltoday.my, and we'll be more than happy to put on whatever you'd like for us to do in Season 3 of Medical Today. On that note, I'm Jared Ratnam signing off. It was a great pleasure being with you right here on Season 2. We hope to come back with more for you on Season 3 of Medical Today. Thank you very much. You have a great day ahead and a fantastic week. We'll be back with Season 3. Bye-bye.